Hello, happy to be here today. So who here in this audience has something in your life that you're stressed about, that you're worried about, that you're concerned about? Every single one of us, right? At any given time, we're dealing with a lot of different things. So that's why I want to take a moment for us to think about stress. And when we think about mental health and we think about mental illness, we really want to think about it being on a continuum. It's not that I have a mental illness or I don't have a mental illness. It's that we all lie somewhere along this continuum, depending on what's happening in our day. If I gave any one of you an anxiety inventory and I was going to screen you, one day you may have an absence of symptoms and the next day you may have a 5 or 6 because you're dealing with something at work or you're dealing with something with your family. And so any one of us, that's why we're going to talk about this concept of how do we build wellness and resiliency in the teams and the staff that they're working with, and where does that really start? So we know that stress is taking a toll on all of us, I think, as a society. And when it's not managed and people haven't developed the skills to deal with challenging situations, when those situations happen, they're not going to have the skills to deal with them. And so, I think it's why we have so much conversation around how to support young people. Each year, the American Psychological Association does a survey where it looks at stress and how all of us are handling it. So what kinds of internal stressors do Americans have? What kind of external stressors do Americans have? And as you can imagine, every year since 2020, the increased rates of stress has significantly gone up. So since COVID-19, we've had like a compounding of the already previous stressors that everyone has been talking about. And it has caused the American Psychiatric Association and the American Psychological Association to declare we are in a public mental health crisis. And we're going to talk about soon that we don't have enough behavioral health care providers to work with all the individuals who need care. If you yourself have tried to get a therapist recently, it's not easy. If you don't have money to pay out of pocket to see one of us, it's really challenging. Yes, there's providers who take insurance, but insurance pays awful, so most of us don't take it. So that's one of the challenges. What we know from looking at this data, we're not anticipating that this crisis is going away. I really think that a lot of us were struggling for so long internally, and we just didn't talk about it because of so much of stigma around mental health. And now it's like we can't not talk about it because it's oozing out of our pores. It's happening with our children. It's happening with our teens. The people who work with us are parents, our mothers, our fathers, our caregivers. And when we look at the stress and trauma, the group that has been being impacted the most is Generation Z. So that's ages 13 to 23. That's our children. I have 2 teenagers. Those are our teenagers. Those kids, we have not seen such significant levels of anxiety, depression, suicidal thoughts, substance use than we've ever seen. They are struggling. Part of the theory around that is as they're entering adulthood, there's such an unpredictability in the world. The truth is it's always been there. Really, we can't predict anything past this moment, but now it's kind of shining a light on it. This generation is really looking at what their role is in terms of mass shootings, what's happening with police. I mean, just all of the kind of social issues. And when we look at the stress, we look at communities of color, we look at our youth, we look at older adults, people with serious mental illness are being impacted at such disproportionate rates. So I say this because these are the individuals that we're all working with, and it's so important for us to think about. And the other thing when we think about stress, so think about people you work with in your office, we're overwhelmed. Most of us have way too much on our plate that's like actually even capable for a person to do. You almost had to like accept that you're just never going to get it all done. And it's just a flowing to-do list. When we look at how adults are responding, the data shows that 50% of adults report more tension in their bodies. We can never separate the psychological from the physical. So we focus on whole person care. So if someone's having psychological stress in their body, they're going to have physical health problems. It's just, you cannot separate the two. We keep our stress in our body, and then if we don't deal with it, it becomes sickness. That's why you can connect it to trauma, cancer, heart disease, diabetes. all of the health disorders. Also, adults are reporting having a lot more mood swings, so yelling more, getting more upset, more irritable. So these are important things for us to know about, especially like when we're working in teams with people. And we're going to talk about the more that we know about how that person in our group, in our team actually is. So asking somebody, how are you? And really stopping to listen. Because if I know that my coworker is struggling with a teen at home who's dealing with symptoms of depression, I'm going to maybe take on a little something extra for her, or check in with her and how's she doing today. Because if I don't, that's when we have people out on FMLA, that's when people can't respond, can't do their jobs. We think about it, people want to do well. We want to do well. Humans are hardwired to be resilient, we're hardwired to do well. So when somebody's not, how do we pause and check in with that person? Also, sleep. Sleep is one of the biggest factors. So how are people sleeping? If you notice your own sleep isn't going well, if you notice you're waking up a lot in the night, that's a good checkpoint. So you hear a colleague who's saying like, gosh, I haven't been sleeping. Right there, I know something's going on with them. The more that we can identify and see people as people, not just people we're giving stuff to as human beings who have this whole multitude of life, the better we can create exactly what we were talking about last time, connection and communities where people feel supported. So I want to review some of the data because it's really staggering and it's important for us to know. 21% of adults, and you may not know about this at work because there's so much stigma, which is like all of us got something going on. We all have something, and anyone who says they don't is lying. It's just that simple. I have like 10 things going on right now. 21% of adults are experiencing mental illness. That's over 50 million Americans. 55% of those 21 adults are not getting treatment. So we have a ton of people suffering who are not getting treatment. These are all the individuals that maybe some of us, if we look at the data. 15% of adults reported having a substance use disorder in the past year, and 94% of them are not receiving treatment. So these are people sitting next to us at work who are struggling. And 4.8% of adults report serious thoughts of suicide. So one of the roles at my job is to go in and work with schools and communities when they lose a child to suicide. So we go in and we do postvention to help support that community get back to life. And so it's very real when you're seeing 10, 11, 12. Again, these are our children of the people that we're working with. 16% of youth reported suffering a major depressive episode, and 60% of them are not receiving treatment. And here's a staggering statistic. So in the United States, there are 350 individuals for every one mental health provider. So not only is it challenging to be able to afford care for mental health, and it's also oftentimes challenging to find a provider. They're out there, we're here, we're trying. But you know, what this tells us is people are suffering. If they're suffering, it means that there aren't enough resources within them and externally to learn how to cope with challenging things that are happening, because challenging things are always going to happen, and that behavioral health providers are not the only solution. When we talk about what we can do in the workforce to build community, connection is protection. Connection is protection. And it's not connection when we're scrolling on social media. It's connection when I'm looking someone in the eyes and we're smiling and we're engaging together. Connection isn't gaming 8 hours in the room or, working nonstop just on task. So what we can do to support connection and conversation and honest check-ins with people at work, if I know someone's struggling, they get less work, honestly, because they're not going to be struggling one day and then someone else is. And I kind of shift the responsibilities based on that. It's also really important to think about where do we land in New Jersey. So I have to say, New Jersey is a great state, one of the best states to live in terms of behavioral health. We have one of the best children's system of cares. We have really some of the great access to care here. We rank number 6. Number 6 out of 51 states. So the higher the ranking means we have the greatest access to care and the least number of individuals struggling with mental illness. So I just We're still struggling, though. I mean, this data applies to us too, but we do live in an area where we have a lot of supports. So what can you do as employers, as the workforce? Anything you can do to increase protective factors. Protective factors is anything that increases the connection between people, the connection between families, communities, anything that you can do. I see there's a lot of like banks here. Banks do so much with bringing communities together and doing events. So those kinds of things, like you were talking about going to happy hour, but anything that, I know sometimes we do like retreats and getaways just for a couple hours. It's nothing even that's, significant. When we think about how do you build resiliency in organizations, so resiliency is not really anything that exciting. It's not revolutionary. Human beings are hardwired to be resilient. We are hardwired to know how to handle kind of stressful situations and to come up to the challenges. So when we also think about what we can do at work, I would say we want to pause and check in with ourselves. So it always starts with us. Everything always starts with us. So what are you doing? What are 2 things you're doing for yourself every day that helps you stay balanced? We have a situation where I've worked a lot in schools and we'll work with, there's a situation, let's say you have a child in school, he's not listening. So you have the teacher, she's getting super frustrated. You got the kid who's like acting out. You got another kid acting out. You got a behavioral tech coming in. Who's the first person that I would go to if I came in that room as a psychologist to work with that group? Who do you think? Would I go to the kid, the teacher, the tech, the other students? The teacher. You always go to the teacher first, because once that teacher loses her homeostasis, meaning her balance, think about a thermometer, the whole classroom is going to go in disarray. If that teacher knows how to self-regulate and do her breathing and do the things that work for her, I don't care if she has a squishy in her pocket. These squishies are great things. That's going to regulate the whole classroom. So it's the same for us when we're working in teams as leaders, as supervisors. I manage a large team. When I'm feeling myself activated, I continue to work on my kind of coping skills to get myself regulated. So what are a couple things that you can do for yourself? Checking in with yourself. The simplest things as like, who doesn't drink water some days because you're so busy? Or you have to go to the bathroom for like 3 hours and you didn't go. And you're like dying because you just keep working. And we're just working. And so those are small acts of self-care every day that we can give ourselves. And when you create a culture of self-care and compassion and allowing humans to be humans, and you're modeling it, because observational learning is the most powerful learning, people will pick up on it. So, thinking about, are you somebody that has a friend? When you see that person, you feel energized? Are you someone who likes to walk every night? Are you someone that likes to meditate or is very spiritual and likes to pray every night? When you notice yourself not doing those things, so think about what those things are. When you notice yourself not doing them, how do you feel? You feel off balanced. And so I always like to say, let's get back to basics. Because when we're really feeling stressed, we manage a ton of stuff. And now we have all these kids who we're talking about who are probably struggling. And they're dealing with all this technology. And a lot of us are parents and grandparents. I mean, we didn't have technology when I was in high school. Well, we did, but we didn't have phones and TikTok and all that. We didn't have it. So, it's trying to figure out such a different world. So checking in with ourselves at the beginning and end of day, taking small, micro breaks. Sometimes, I'll go stand in the bathroom for a couple minutes and just be like, I don't want anybody to talk to me, and just kind of regulate myself. So think about 3 things that matter to you, what you can do, how you can do them, and then how you can even create conversation in your teams. One of the things that we do at work, and I know we're a bunch of psychologists and behavioral health professionals, but it really creates community and connection. I start big meetings with what we call pies. So it's a 5-minute check-in, and we do a lot on Zoom. We put people in rooms. How are you doing? And you say 2 words. You don't go into your past history. How are you doing physically, intellectually, emotionally, and spiritually? And you could say spiritually or socially. And so people will give that. And let me tell you, it tells you so much about somebody in those couple minutes, and then we get starting. But what it says is, I care about you. I see you as a person. You know, we're here to support each other. I'm taking care of myself. How are you going to continue to take care of yourself? So thank you so much for your time.